Slap! The damage to competitors is real, potentially even deadly, and reality is not slow motion. We're breaking down the dangers and damage from slap matches and comparing them to other brutal, full-contact sports. And we'll end with one of the most tragic injuries in all of sports. I'm Dr. Som, the reconstructor. Let's punch through the truth about slap. No dodging, no defending, no dancing like a butterfly away from these hits. Competitive slap fighters take the full force of a blow, unprotected. The damage can be catastrophic. Nasal fractures, orbital fractures, jaw fractures, dental trauma, even tooth loss. Facial fractures are not just cosmetic issues. The dangers are real. Breathing obstruction, visual field or vision problems, jaw misalignment, and more. Repetitive trauma to one side or the other will cause loss of the soft tissue. This can lead to atrophy from the repeated trauma and asymmetries. What if there's an actual fracture? The nasal bones are small little bones that line our nasal cavity, and they're up high and then cartilage down low. But this bone, once it's broken, can cause deformities, asymmetries, breathing problems, obstructions of the airway. So getting it treated is important. Some of that can be done with closed reduction. So from the outside, we can create alignment and going inside without having to make cuts. If we're talking about airway obstruction, we need to recreate and reconstruct the airway to allow for normal air passage. And then for the bony fractures, we need to realign the bone and help support it until it heals. What if they actually have a fracture of this bone or the bone around the eye? One of the things that could happen if there's a fracture is if the floor of the orbit is gone, the eye will fall into that pocket. That causes entrapment of the eye or its ligaments. There are a series of muscles that make our eyes move. If that happens, that can cause permanent damage to that muscle. It can die and you can lose permanent function of the eye. So when there is entrapment, whether it's the eyeball itself, the globe, or one of their muscles, it is very critical that we do surgery urgently. We open up the eyelid from the lower part, we go inside and we create a mesh to help reconstruct that bone. Jaw fractures happen fairly commonly as well, whether it's from a slap or from a car accident or other trauma, like a baseball bat to the face. Then we have to go in and repair the jaw bones, usually again with plates and screws. Most of the surgery can be done from inside the mouth to not leave scars on the outside. The other thing a lot of people, when they hear of a jaw fracture, think of is wiring the jaws shut. That is one common way that we do to fixate the fractures, and that involves metal wires between the teeth from the top to the bottom to help hold the jaw in alignment. It's not fun. People talk about how they lose a lot of weight because they can't eat everything, have to drink it all through a straw. Nerves are sensitive things. Whenever we operate or are talking about the face, it's one of our primary concerns. And from enough trauma, you can have damage to those nerves and you can end up having stroke-like symptoms. But it's not just your face taking damage. Delivering repeated high-force slaps places significant stress on the hand and wrist. Common injuries include fractures, ligament and tendon strains, or even tears. This damage can be treated. Most of the time, we will do it under general anesthetic because the tendons and ligaments are under strain, and we need someone to be paralyzed for us to do the repair. We bring the tendons and ligaments back into realignment, and then using sutures like anywhere else, these can be put back together. But obviously, repeated trauma can cause long-term arthritis and other damage later on in life. But the most dangerous injury isn't the one we can see. It's inside the brain. Concussions, as common as they are, can lead to long-term neurological effects. The brain is in a hard, fixed place, the skull. So if the trauma is severe enough, the part of the brain ends up slapping into the skull, is gonna basically get some kind of a bruise. It's not really a bruise, but sometimes if that slap is hard enough for trauma, one of the blood vessels can rupture and there could be bleeding inside the brain. Bleeding or hemorrhage, in some cases, needs to be evacuated. So if it's large enough and starts to push on the brain, we need to let that blood out. Drains can be placed in some cases, or in cases of a lot of bleeding in dangerous areas of the brain where it starts pushing on the brain tissue, craniotomy needs to be done where the skull is opened and that blood is removed by a neurosurgeon. And repeated blows to the head may lead to chronic traumatic encephalopathy, or CTE. Scientists have studied these for years in other high-contact athletes. In some tragic cases, like wrestler Chris Benoit, it can lead to dramatic cognitive and behavioral dysfunction. And there's no known cure. But there are some things we can do to help these patients or people that are suffering from concussions, traumatic brain injury, or CTE, then encephalopathy. One known thing that has been proven, the military uses it for our veterans, is hyperbaric oxygen chambers. You go inside, it gets pressurized like an airplane, pushes extra oxygen into the body. That oxygen goes wherever it's needed. And in patients with traumatic brain injury, chronic encephalopathy, whatever it may be, the brain wants that extra oxygen. So it sucks it up, and it's been shown to have significant improvement in their cognition. The only way for us to really know and diagnose CTE is from an autopsy. We don't know enough about it to know more, but at this point, autopsy can be done. When examining the brain tissues, there are some telltale signs that can maybe be seen on some imaging, but really the most diagnostic feature is abnormal tau proteins that are seen within the brain. SLAP may look simple, maybe even silly, but the forces at work mean real danger to participants. The risks are real and consequences could be lifelong. As the popularity of SLAP fighting grows, it's more important than ever to understand those dangers. I'm Dr. Sam, the Reconstructor, reminding you to dance like a butterfly and sting like a bee.